So for the record, folks, today is December the 3rd, 2023. My name is Jonathan Jones. It's my pleasure, my privilege to be your host and moderator for today. We're talking about cancer, improving the outcome. And as Bernard and Jeff Ashby so nicely expressed, we're at a time today where cancer is just ravaging every place and everyone is dealing with it. And it's bone chilling if you ever hear those words. And that's the reason why we're talking about this. I have been doing research for quite some time, but it was mainly because I just was not satisfied with what happened with my mom. It bothered me that the intensive care nurse said to me that she was praying for my mom's immune system to kick in. And I believe that the intensive care unit should have had something to kick her immune system in. So it just was not right. So that's what turned me down this path of becoming a researcher. So today we're focusing our attention on cancer and improving the outcome of conventional cancer treatment. We're very careful. We're very careful with what we say, and the reason for that is because the law only allows us to be able to express things a certain way. And that's why our disclaimer, as you can see, is that the FDA has not evaluated these statements. Testimonials are purely anecdotal. Results are atypical. You're going to be hearing some testimonials and recognize that what happens to one person may or may not happen to you. And by law, we have to say that because Engage is making no claims that microdaily would treat or cure any disease state. Dr. Prasad is not making any claims that these products, his formulas, will treat or cure or heal in any way. None of the hosts or co-hosts are making any claims along that line. We're telling you about the food that's missing from our food. And we really want to try to make that clear, folks. But there's hardcore scientific research out there that you and I need to be made aware of. Everyone needs to know about this because a lot of it is simply not being told. You may be saying to yourself, well, why? Why isn't it being told? Well, that's a very good question. That's not the forum. This is not the forum for that. But I can tell you that in fact, they make 4 times the amount of money treating cancer than they do on the cancer itself. It's the side effects of it. It's enormous. So that's the reason why we're having this discussion as we are. So to just kind of reiterate real quickly, the CDC indicates that cancer is the second leading cause of death in the United States. The side effects are extensive. No question about it. It is worth our giving attention to it. One of the first things you notice is nausea and vomiting. That there's no surprise to that happens. And Dr. Prasad is going to give us an explanation as to why it is that folks have this kind of reaction to chemotherapy and radiation. Why is it that there's fatigue, extreme fatigue, when a person is being treated with chemotherapy and radiation? What is it that causes that? And what about hair loss? Why? What leads to that? And why is that such a horrific outcome? And it is a psychological impact on a person when they do lose their hair. And when it comes to being immunocompromised, those who are dealing with chemotherapy, radiation, they are among the first to become immunocompromised. Their immune system takes a harsh nosedive. And Dr. Prasad is going to explain to us exactly why that is the case. And then there's this expression here, this cognitive impairment. This is like the 4th or 5th on the list of the top 10 side effects of chemotherapy and radiation. They call it chemo brain. What is it that causes that? And again, folks, take a snapshot of this screen right here, because everything you see here, when Dr. Prasad put his formula together, his formula was all about improving the outcome. The one thing that they don't mention on this screen is that death is a potential side effect of some of the conventional treatments. And it is. That's just on public record. You can look it up for yourself, that some of the treatments can cause death. Dr. Prasad's formula is all designed to help improve or alter the outcome, all of the side effects. So it is my pleasure, my privilege to introduce to you and to our discussion now, Dr. Kedar Prasad. Dr. Prasad was the professor at the University of Colorado School of Medicine for some 30 years. He was the director of vitamin and cancer research. He was also a former president of the International Society of Cancer and Nutrition, a member of the Royal Society of Medicine, London, UK. He was also part of the Nobel Peace Prize nominating committee for candidates in the category of medicine. Dr. Prasad was the world's first radiation biology PhD, and his products have been awarded some 8 US patents, with more on the way. And so we're excited that we have this gentleman at our fingertips. When it comes to identifying the anti-cancer nature of things, Dr. Prasad is the one given the credit to identifying that vitamin E succinate has anti-cancer properties. He also figured out that butyric acid, the small fatty acid formed by the fermentation of fibers in the gut, is an anti-cancer agent. He's been the author of some 33 books, many of them on the subject of cancer, and he's been published some 250 times in peer-reviewed publication. Now, you just take a screenshot of this list of his books and publications, you'll see that many of them are on the subject of cancer. So we are very fortunate to have Dr. Kedar Prasad available to us to have discussions like this. So folks, it is my privilege to welcome and introduce to our discussion now Dr. Kedar Prasad. Dr. Prasad, thank you so much for your willingness to join us on discussions like this and to share with us your knowledge.
Thank you, Jonathan. As usual, I always enjoy discussing the topic of your choice. And this is a great interest, like you said. Every member or people know about it. Somebody has a cancer. So cancer is 2 aspects. One is prevention aspect that we are not going to discuss, and one is the treatment aspect that we are going to discuss. And as you know, that I have obtained a patent for the high-dose antioxidant in cancer, improving cancer treatment. And so my goal there is to have enough clinical data. Somebody has to help me to do that, financially speaking, and then get a FDA approval. Until you get that one, it cannot be over the... So that formulation is a little bit different than what I'm going to suggest today, because it will at least, the one which I will be suggesting you, at least it will be high-dose antioxidant. And so, but I want to make a distinction, what I'm going to suggest to you and what my formulation is, which has been approved for the patent. And this is independent of Engage Global. And so because my goal is, until FDA approves this, it cannot be reached to wide audience. We can reach some like we are doing now.
Right.
And even one person get benefit, that's good enough for me. But, my goal is to have a FDA approved formulation that I have developed it, and for that it has been approved, patent, and then get the FDA approval. So that will take time. In the meanwhile, people are still having cancer, getting treated, dying, and so on and so forth. So we have to develop some intermediary steps we can do it. And that's what we are going to do. And Engage Global has a product that we can use as a transient phenomena in a meanwhile. And so now the question, like you mentioned it, that this is a real challenge for oncologists, what to do with some of the side effects, Jonathan, that you mentioned. But also another side effect is the late effect of radiation, those who survive cancer 5 years or more. That is also very important. And side effects will include development of a new cancer, occurrence of the primary tumor, reoccurrence of the primary tumor that you were treated with, and also necrosis of the muscle, for example, non-neoplastic diseases like that. So there is a lot of, side effects possibilities. So that not possibility established. And people, at one time, Dr. Bill Robinson, when I was in Denver, he was giving a lecture, and he said that, 100 years from now, when people will think about cancer treatment, they will think that we were stupid to treat cancer with the cancer-causing agents. So this is true. This is true. At that time, I never realized it, but I was saying that's probably true. But we don't have any other choice. So we have to do as best as we can what we have. And so, but there is no question, radiation is cancer-causing, chemotherapy, cancer-causing agents. And so, but in any case, we have made some improvement in a 5-year survival rate. And so the question is there are 2 questions. how to improve the response that we are getting today. One. Second, what to do to reduce the toxicity during treatment. And some of the symptoms that you mentioned, Jonathan, is a classical side of acute. We call it acute side effect, and late side effect is different. But how to reduce for the time being? If you can reduce the acute effect, late effect would not happen.
Right.
Would not occur, or at least markedly reduced. So the first goal is it. So the question is what we can do it. As you know that in this case, Linus Pauling, who was a 2 Nobel laureate, was the first to suggest that high dose of vitamin C can kill cancer cells and not affecting normal cells. So everybody at that time, I remember very well, he applied for a grant to NIH and NIH turned it down. And everybody criticized that he's senile and so on and so forth. But anyway, I thought that he can't be senile because he has won 2 Nobel Prizes. So I started working on vitamin C, and I found that the cell line that I was working was neuroblastoma, which is a childhood brain cancer.
Right.
And so neuroblast. So I said, okay, I will test vitamin C. So vitamin, sure enough, it killed cancer cell, and we have a normal fibroblast, normal cell in culture and in a petri dishes. And so, but it was normal cell was not affected with the same dose that we were killing all neuroblastoma cell. So I said, that's so. Then I further went. I said, let us see what happens if I can combine with the chemotherapeutic agent. Most of them I use them, and also radiation. Indeed, we found that the lower dose of vitamin C, high dose still, will enhance the cell-killing effect of chemotherapy and radiation while protecting the normal tissue at the same time. And I published this work, and I think with the proceeding of National Academy of Sciences, we call it PNAS, which is a highly prestigious journal, and it has to be a sponsor. So I think Linus Pauling is the one who has sponsored that paper. And so that was one. Then I wondered that what happens is vitamin C is one. How about vitamin E? So at that time, everybody was using vitamin E acetate. So I used vitamin E acetate, and so it has no effect on cancer cells. So I asked my wife, who was doing my technician at that time, she was working with me in my lab. I said, why don't you look what other types of vitamin E is available in the marketplace? And found out 3 or 4 different types she ordered it. And one of them was vitamin E succinate.
Wow.
I all tested everybody, but vitamin E succinate in melanoma cell, which is very tough to treat, as you know. It becomes like a normal melanocytes and inhibited it. And then again, same thing I did, combined with the radiation, combined with chemotherapy, did the same thing, enhanced the effect of cell-killing effect of chemotherapy and radiation on a cancer cell, but not normal cell. And so that this paper we published all these things going on, but I never understood it, why it is happening mechanistically. Why?
But that's huge, Dr. Prasad, that you found it, because other scientists have built off that now. Hundreds of papers have been published
this work
since
that
then.
has been confirmed by many other people. So it is not just my work; my work has been confirmed even in animal model, not only in cell culture model, but even in animal model. So that's
incredible.
True. But what was for a while bothering me was that how can I explain it? It is not happening because antioxidant is a free radical scavenger. So it has nothing to do with free radical, this high dose, because it is enhancing the effect. And then I said, how about this occurred to my mind, that does cancer cell require some specific nutrient for survival and growth? So I looked the literature, I found out, sure, cancer cell requires excessive amount of glucose because they have inefficient system of producing. That's the picture of Linus Pauling with Che, my son, and Judy.
Yes. That's history.
Yeah, but so in any case, so it was. So I found out that the cell requires, say, glucose, And glutamine, without that, they will die of starvation. No energy and no vital molecules. Glutamine is very important to make vital molecules for your survival, like RNA, DNA, and many other things, very important. And so then I said, maybe it is possible that that high-dose antioxidant have nothing to do with free radical scavenging or destruction of free radical. It blocks the uptake of glucose and glutamine, and so cell die of starvation and lack of energy. And so then I said, when I started doing research on this issue, I found out, sure enough, high-dose antioxidants blocks the uptake of glucose and metabolism of in a cancer cell, but not in normal cell. Normal cells don't get affected. And so then I said, well, okay, I got it now. So then I started doing it,
Yeah,
and
you
then
got it all right.
patent and so on and so forth. So right now, so what we are doing right now for the time being, until I find my investor for my formulation, that we have micro daily hydro, for example, and we suggest that if you increase three times a preventive dose, means suppose if you are taking hydro 3 in the morning, 3 in the evening, that would be considered a high doses of antioxidant, because a preventive dose has about 1.5 1,500 milligram of a vitamin C, and if you multiply by it, it will be close to 5 grams.
Yes.
And that's the minimum amount that we think, it can go 4, depending upon what kind of cancer it is. And so, but in the beginning, I think a 3 is good enough to start it, but it can go 4 times too.
Well, and we actually have some information or some examples that substantiate what you're saying, Dr. Prasad.
Yeah.
Because I mean, there's a lot of folks here right now that are on this program that are hearing what you said for the first time, that this high antioxidant thing stuffing or plugging the mouth of the cancer cells is incredible. That's incredibly important. But do you mind if we share maybe 2 testimonials that
Sure. No,
actually support that? And then we're going to want to hear about your formula, your recommendation as to why it is that micro daily and the core 4, are beneficial approaches to this as well. So
yes.
I think that would be very good. So Beth has I just need to warn everybody, we're going to be showing an actual image of a human face here that's been infected by cancer. So if anyone is uncomfortable with that, now would be the time for you to maybe step away from your screen if you don't want to see this case. So just to let you know, but again, remember folks, testimonials are purely anecdotal. What happens to one person may or may not happen to you. Beth, are you with us now? Let's see, we have to can somebody give Beth the ability to invite Beth? There she is.
I'm here.
All right, Beth. So you want to tell us a little bit about what's going on with this client?
So in August, around August 2nd, his wife came to me. She had just learned about this product.
August 2nd, this year, 2023.
Yeah, so there was no time for them to get shipments. So she came and picked up product at the house, and he was going to get treatment. He was going to get 33 rounds of radiation. It was under his eye. So I told them to take the 12 capsules twice a day, along with the omega-3 probiotic, and to do digestive enzymes before his meals, and do a couple packs of hydro during the day. And he faithfully did this. He did it every single day. He had his last treatment September 26th, around there. And we physically saw him when we had our Super Saturday in Charlotte. And the pictures that you have, I took a picture close up of his face. You can't even see the scar. So that was within 90 days of 33 rounds of radiation, plus doing the protocol that was given to him that I told him and his wife to do. But the biggest thing that he did, he listened, he did it, and he got the results. And I guess you're getting ready to show it. Yeah.
Was he taking the protocol during treatment as well?
He started it right when he started treatment.
First treatment, okay.
That's when they got it. So
Yeah.
he wasn't doing it way ahead of time. He just learned of the product.
Sure.
They started maybe 2 days before he started treatment. He had 33 rounds of radiation
That's amazing.
within what is it, about 8 weeks, maybe? I don't know, something like that.
Yeah, yeah.
And the thing about it is he had no downtime. He was not sick at all, and his energy never left him.
See, that's what the experimental data I was talking to you, at least in one example here, is confirmed. That if you take during the time, you get a maximum benefit of both. You have cancer, you don't have side effects. You can see that he has still all the hair, that he has beard and everything else, never lost one. And as you mentioned, Jonathan, that during treatment, almost everybody loses hair. Temporarily, but it loses hair. But in this case, you can see that high dose of antioxidant not only enhances the effect of radiation, but also protect the normal tissue. And in this case, he's also trying to heal it faster once they get damaged.
And to give him a shout out, because he is a Marine, he's in the military, and he's also gone through a blood disorder for many, many years. So this is just amazing. And he is 72 years old. So he, you know, he kind of had all the odds against him, but, you know, he believes in the Lord. And then also, you know, he has this. So, hey, what can we say? Thank you, Dr. Prasad. From them to us, we really appreciate your work and your lifetime commitment to helping so many people out here.
That's great. And
My
see,
goodness.
what
This doesn't
generally
surprise you.
See, this is very important, that even though he has started rather the same day, or, you know, that he was getting radiation therapy, what in my patent we have said that you start 7 days before you get the radiation and chemotherapy. So by the time it comes, most of the cancer cell is already dead. Many cancer cells, because cancer cell would be selectively getting killed. Now, when you come to radiation therapy, then some more will be killed, while your normal cell is being protected, and then continue at least a month after the therapy, so that there is no residual things going on, and then gradually reduce to a preventive dose.
So I have a question. I
Sure.
don't mean to take over the show, but
No, go ahead,
so
please,
what if somebody is, say they've already done their rounds of radiation, they've already done their rounds of chemotherapy, and they were to start on this, you know, like myself, I was poisoned by radiation, but I didn't get your product till over a decade after it.
Yeah.
So it's still going to restore the damaged tissues.
Yes.
That's been caused by poison, correct?
Yeah. Yeah. So no, but in that scenario, suppose if somebody has a cancer-free, survive 5-year survival, and then they have a risk of a late effect. And that time, I would say, taking it twice a dose would be sufficient to prevent the potential late effect of the radiation or chemotherapy or whatever cancer treatment you had.
And then also too, that people have to understand, you can't come off that high protocol like that and go down to just a minimum overnight. You got to
you can't. That's what I'm saying.
Down.
Very gradually, at least, you know, like reduce one capsule per week or per 2 weeks, then, you know, gradually within a month, you gradually goes down to when you do. If you do suddenly, that your body is used to high dose, and if you suddenly stop it, then you feel body feels that you are deficient. The body is deficient of micronutrient, and then you don't feel comfortable. So it is very important, Beth, you mentioned that it is important to, once you try to do it after, say, month or 2 months, that make sure that it is cancer-free, and then you gradually remove, very gradually.
So right now he's about at 10 twice a day. And he's going down slow, but I mean, it's just amazing. And you know, this is not a miracle, y'all. This is science. This is chemistry that the body needed. All it is supporting the body so the body can do what it needs to do through the treatments.
Exactly. That's exactly the case. And you know, and while the chemotherapy is doing their job, but their potential side effect, normal cell is protected, but cancer cell is dying by different mechanism, has nothing to do with free radicals. Because chemotherapy and radiation, most of their effects is mediated by free radicals. They produce a lot of free radicals. And so and that's why it damages both chemotherapy and radiation damages both cancer cell and normal cell because free radical cannot distinguish it. But in high dose antioxidant has nothing to do with free radicals. They bypass it. And so then because it blocks the glucose and glutamine, and therefore they die of starvation. And so this is very important to remember that this is the difference. So even though sometimes tumor become resistant to all therapy. Why? Because tumor cells later on expresses very high level of what is called NERV2. And NERV2, as you know, activation is very important to produce antioxidant enzymes. And when they produce antioxidant enzyme, one of the enzymes is glutathione peroxidase, which makes glutathione up. And if glutathione up, they become resistant to chemotherapy and radiation because they produce most of their damage by free radicals. But in case of high dose antioxidant, it has nothing to do with free radical. They kill tumor cell by different mechanism. So for high dose antioxidant, makes no difference whether it's a tumor sensitive or tumor resistant. They will still die because they will need glucose. They will need glutamine.
Wow, that's incredible, Dr. Prasad. So, I mean, what you're saying here that is clearly you're not surprised at all.
No.
See this kind
this
of
is
thing.
what I predicted. This is what I predicted, but sometimes prediction is not always right.
Wow,
Nice to
incredible.
see that it is true not only in the animal model or cell culture model, but is also true in a human model. And at least in my two experience, anecdotal story is from Denver. One was the patient of fourth stage pancreatic cancer, and even fourth stage, very advanced. Doctor said that Dr. Shafroth, you have 3 months to go. So out of desperation, he sent somebody to my lab, and I talked to him. And at that time, I had no product. So I had suggested him individually high-dose antioxidant. And they followed, I guess. When you are desperate, he followed it. And he was a lawyer. With a law practice, he lived great quality of life for 3 years, attended marriage ceremony. And when he died, he told his wife that any flower or nobody sent to, and whatever money they spent in my funeral, they should donate to Dr. Prasad Laboratory. And at that time, I got about, I don't know, $25,000 or $30,000. And I established a Shafroth Memorial Fund at the university. And his wife continued to support every year $5,000, $10,000 for my research. And so that's one. Second was she has a breast cancer, and she was editor-in-chief of Boulder Camera. This was a local newspaper. And again, at that time, I did not develop any formulation. But I was knowledgeable that high-dose antioxidant is working in experiment. So I again suggested him, and she got tumor-free. And when I actually developed some kind of formulation, as you know, Scientific Nutrition was my first company, ran from the garage. And she wrote a whole big articles and put my name all over the country. So overnight, we developed a couple of thousand customers. I mean, not overnight, but in a couple of weeks.
Well, that's anyway, incredible.
So those are my experience of anecdotal story. But at that time, I never thought a great deal about it.
I know. Well, we're glad that you started that way. We have one more that we want to share.
Sure.
Especially because we have 270 connections on this media now that probably have never heard someone else also had a very similar outcome. It was not just with either radiation and something surface, but this woman, Iris, was being slammed with all kinds of chemotherapy and radiation. So we'd like to hear your comments on that one too. So Jeff, do you have that one? I think I've got it, but if you've got it, I think it will be good.
I do, Jonathan.
All right,
And
great.
in fact, let me just pull myself up here. Yeah, in fact, if I can, I'd like to share too, because Iris, we just met with her when we were in Albany, Georgia, about 3 weeks ago. Amazing journey, but this is just right after her experience, this first one. And then I have one more that I would like to share, that somebody that they were so compromised that they couldn't continue the protocol. Their body would not handle the chemotherapy. And so, yeah, let me just share Iris here first, and then we'll go to Susie. So here we go with
Excellent.
Iris.
Most of you know that I did have cancer. I think it was 2018. And I met I've been knowing Miss Dolores for a long time. But then, she had introduced me to the micro daily. So with God in prayer and Miss Beth, I decided that I would go ahead on and take the micro dailies. And I did it before I had surgery. So I needed to get it in my system. So once I got it into my system, when I had my surgery, I did not have any pain. I did good. Then after that, I did 8 rounds of chemo. And chemo it's poison. It's a lot of poison that's going inside. Okay, didn't get sick one day because I was constantly taking my macro daily, constantly. Then I did 33 rounds of radiation. Didn't get sick, didn't hurt. So now I'm on this thing called tamoxifen. It's the pills after cancer. And one of the side effects is the bones. I should be aching all over. But because, God has prepared me along with Ms. Beth to be great, of course, He allowed me to not have any pain whatsoever. And I go around, I talk to my clients about, a lot of them have blood pressure problems, all of these different problems. I'm like, you know what? I had cancer. And this micro daily, it attacked that cancer. And I tell you, I'm just grateful. And that's my testimony.
Thank you.
Wow.
That's the exact.
Jonathan, yeah, I just like how confident she is in her experience. And
Yes.
4 years later, we just met with her again in Albany, and to talk about awesomeness. So this next one, just really quickly, I'm going to share Susie with you. And Priscilla's actually on this call. We reached out to her and said, this is going to be happening. And so Priscilla, who Susie is so appreciative for, is here. And I want people to understand that this gave Susie hope. And she explains that. So here we go.
Hi there, my name is Susie Reynolds, and I want to share with all of you my condition that I was diagnosed with. I had cancer, and I was diagnosed in October of 2020 with cancer. I had a stage 4 gynecological cancer. I had a spot on my liver, a spot on my spleen, and a spot where my gallbladder used to be. So I decided to try the chemotherapy, and I had 4 appointments and only 2 sessions of the chemo because my labs are so low that they wouldn't do the chemotherapy. So something told me, and this was like November, I was diagnosed, and then December and January. And in February, there was something that spoke to me about, I needed to come see Priscilla. And I had met her in 2019. And there was just this gravitational pull to her office. And so February 5th, I came to see her of 2021. And Priscilla is guided by God. We prayed together on February 5th. We prayed, and she put me on Micro Daily, which I'm continuing to take. I love it. And I want to thank Dr. Prasad for his supplements that he's made. I think it's wonderful. And thank Priscilla for having these nutritional things that I'm using. So I'm using the Micro Daily Original, I'm using the Brain Boost, and I'm also taking the Eye Boost. I've changed my diet and all of that. And I can't tell you, and I've quit drinking alcohol, and I can't tell you how wonderful I feel through all of this. And in 1 month, my oncologist had told me that my numbers were 900 plus. And in 1 month, after seeing Priscilla and continuing to work with her, in 1 month, I'm down to 135. Now, I'm not out of the woods yet, but people that have no cancer have numbers of 35. And that's where I know I'm going to be. In 1 month, only 1 month, with all this therapy, the Micro Daily, all the nutritional supplements that she has me taking, in 1 month, I have gone down that much. And my cancer is nearly gone. I have hope and I have faith that I am going to be just fine. I get goose chills just thinking about it.
That's amazing.
Yes.
So tell us, Dr. Prasad, what do you think when you hear this?
I mean, that's again amazing story. I'm very, very happy to hear that. That what we initially observed in a cell culture model, and that is still coming true.
Well, do us a favor. We have a few questions that folks want to ask.
Sure.
Tell us how it is that your products contribute to someone getting a better outcome when they're receiving chemotherapy and radiation. We're looking here, and this just looks like a bunch of antioxidants. Is this mimicking the patented formula that you submitted?
No, yeah, there is a the dosage is higher than what we have here, because this is a preventive dose. What you are showing me is a preventive dose, but individual micronutrient is, for example, in my formulation, we did not need it for acetate, because this is good for prevention, has nothing to do with cancer. Right. So in my formulation, we eliminated it. We have only succinate. So there are a few differences, but basic thing is same. And vitamin C, vitamin A, saccharopirat, B vitamin, you give them just small amount just to make sure they are there. And so, but also in this case, we don't have it. I think we have it though, like alpha lipoic acid, conjunctin, beta carotene. We also had in the new formulation, curcumin and resveratrol and quercetin, but not green tea extract.
Right.
So it is a different formula, but the important thing to remember is a high dose.
It's high doses.
High dose can vary from 5 to 10 grams. And I don't remember how much I have given the exact doses, but anywhere between 5 to 10 milligram would be adequate. Would be defined.
Okay, so clearly, Dr. Prasad, though, these are individuals. Every single one of these testimonials all came from therapeutic dosages of this formula. So taking
this formula, exactly.
triple the amounts.
Yes.
Triple. That's enormous.
Yeah, exactly. And so as long as it's a high dose, cell doesn't care from where it is coming. As they see, oh yeah, it is high dose antioxidant, blocks glucose uptake and glutamine uptake, and they said, okay, you can't make energy, you can't make any important molecule for survival, so they die. Has nothing to do with free radicals. And this formula is to destroy free radicals, to reduce inflammation. But high dose antioxidant has nothing to do with this mechanism by which these things work at a preventive dose.
And we're talking about protecting your good cells. Yes. And really facilitating the chemotherapy radiation to be able to attack the bad cells.
Yeah, bad cells, because their bad cells will be dying by free radicals, and while protecting against, so you have high dose antioxidant, they will protect normal cell, because they will protect against free radical damage that chemotherapy produces it, but for cancer, they care less, because you are going to die by starvation, not by free radicals.
Right. I got you. That's beautiful. That's exciting for us to hear, Dr. Prasad. Now, you're recommending probiotic daily as well. And
Yeah,
there's no
because in
surprise
any
here.
disease, in cancerous, the intestinal dysbiosis occurs, means number of the harmful bacteria increases.
Right.
And when they increase it, they produce a lot of toxic chemicals, which can damage things, increase the rate of progression of the disease, and so on. So we recommend that these things, for at least for the adult, we recommend that take probiotics with prebiotics. That is very important to have it. And again, for example, one case somebody mentioned about pancreatic cancer the other day. If you have pancreatic cancer and some surgically something was removed, but then you have also a problem if your pancreas is involved, digestive enzyme, because one of the major sources of digestive enzyme is pancreas. And so then you have, for that kind of patient, you must have a digestive enzyme as well. You see, there are multiple focus of the items depending upon, and in general, if you have a cancer, it is possible that if you are feeling sick, and also that they stimulate the immune function. So your immune system is also protected while getting chemotherapy and radiation. So you won't have suffering from any kind of toxicity.
And they mentioned that one of the side effects was constipation. So the probiotic is going to be helping with the constipation as well. So
as probiotics as well as digestive enzyme, because if the food is not digested, you can have a constipation as well. So that's both really very important for cancer patients. Omega-3 is also important because sometimes suppose in case of somebody has also diabetes, for example, and become insulin resistant. First, as you know, omega-3 is a fatty acid. It is it is absolutely essential for your body. Your body do not make omega-3 fatty acid. You have to rely on diet. And fish is the richest source of omega-3 or supplement, because not everybody can eat everyday fish. So omega-3 supplement is the best way to get the omega-3 for yourself. So in cancer patient, because this is required for your good health, it doesn't have directly cell-killing effect, but it maintains your overall health. And therefore, if normal tissue is protected by virtue of high-dose antioxidant, and then this is also protected. And because, omega-3 fatty acid, if you just have chemotherapy without any high-dose antioxidant, they will oxidize because free radicals are produced. Free radical will damage the function of omega-3. So whatever little omega-3 in your body is also get destroyed. But using the way we are suggesting it, then omega-3 is protected because you are reducing the free radical normal tissue damage. And therefore, but omega-3 would be for general health purpose. This is important to have it. And so you get maximum benefit.
Outstanding.
But don't take collagen. Collagen peptide is the only one I said don't take if you have a cancer.
Right.
And why? Because what collagen peptide does, because sometimes immune cell produces what is called cancer T cell killing, cancer cell killing cell that will kill cancer, because for immune cell, cancer becomes a foreign cell because it is different. So by the T cell, they try to kill as much as possible, but it is not sufficient. But whatever little effect it has, that the collagen peptide blocks the entry of the cell-killing lymphocytes to the environment of cancer. So cancer cell can't get the lymphocyte, so they can't get killed by immune system, and therefore they will continue to grow.
I see. So it reduces that chance. Okay. All right. That makes perfect sense. And thank you for sharing that.
Yeah.
So what about the brain boost, Dr. Prasad?
Brain boost, like
chemo brain?
Yeah. One of the acute side effect is brain fog. And during that time, you start forgetting things. So in order to improve the brain function, you give a brain boost. We have given in brain boost curcumin, and as you know, brain is exposed to normally anyway very high oxidative stress, but especially during chemotherapy or radiation, they get more free radical exposure. And so Brain Boost has a curcumin and resveratrol, very powerful antioxidant and anti-inflammatory agents. It has also, we gave, increased the level of this coenzyme Q10 and vitamin B3. These two molecules are required by the mitochondria to generate energy. Even though we have in a micro daily EMF, but we added additional amount, and therefore to improve further, give us mitochondria some more break to generate sufficient amount of energy. And we also had two precursor of membrane. One is phosphatidylserine, another is phosphatidylcholine. These two molecules, compounds, are precursor of membrane. And as you know, brain is very rich in membrane. And so and easily get damaged by free radicals. And so once the damage, but the new membrane are formed. So by giving this new membrane will be formed, and you're also giving a protective agents, so they will be protected from further damage, future damage.
I hope you guys heard that. We're talking about something here that will help with chemo brain and that brain fog. So just keep that in mind, folks. That's a good one. Dr. Prasad, someone asked a question in the chat there about turmeric and curcumin. They said that their health practitioner told them that that's not good when it comes to treating cancers and things like that. Is there any harm? Is there any downside to turmeric?
No, not only downside, there's the upside, because curcumin and resveratrol has been shown to block glucose uptake and glutamine uptake in a cancer cell. So that guy is not knowledgeable.
Yeah, clearly not well informed.
No,
so I hope you all are hearing this, folks, that Dr. Prasad's patented formula, it's right on the cusp. It's in the works. The very essence of what we're dealing with microdaily EMF is now being patented as a supplement with cancer treatment. So a person can be going through their cancer treatment and they can take Dr. Prasad's formulas and they can find themselves benefiting to a great degree and getting better results. We've shown you just 3 of many observational examples of individuals, anecdotal, of course, who have gotten very good results with Dr. Prasad's formula. So we're excited to be able to share that with you. And we do want to make an announcement that Engage Global has a special going on till the 15th of this month. You might want to take advantage of this, folks. Dr. Prasad, people use CBD in their cancer therapies.
I think what
anxiety?
It is not directly involved in a cancer cell killing, but many cancer patients have anxiety, depression, because the word cancer, like you were mentioning, frightened people. So to reduce that kind of anxiety and depression, I think CBD is extremely valuable. Why? Because, for example, CBD can enhance the serotonin is one molecule in the brain that keeps you quiet very much. And actually, so that's one thing is that there is an anti-anxiety drug which works as an inhibitor of serotonin reuptake. It's a prescription drug, but it does the job because it increases the serotonin level, prevents the serotonin from degradation. But CBD has also act as an inhibitor of serotonin reuptake. But CBD has a disadvantage that it also increases the synthesis, not only prevents the degradation of a serotonin, but also increase the synthesis of this one. Another thing CBD does is that also increases the dopamine level, and dopamine level makes you happy. And so by increasing these kind of things, your anxiety and depression get dramatically reduced, and it is very powerful, in all kind of neurological issues.
Wow, that's incredible. Does it have any effect on inhibiting or blocking cortisol in any way, the stress hormone?
A stress hormone, not directly, will cause anxiety, depressions.
Okay.
And so by doing this, you will reduce the effectiveness of cortisol because you are increasing serotonin level as well as dopamine level.
Wow. Okay. Well, there you have it, folks. There you have it. So get back with the person who invited you to this discussion, and they will help you to put together the bundle that's best for you. You're going to want to go with the basic bundle, and you're going to want to add the omega and the digestive enzyme to it, and the CBD bundle that you just saw. All right. So you want the basic bundle, you want the omega-3, and you want the digestive enzyme, and you want the CBD. Those are the items that Dr. Prasad just discussed with us. So just get back with the person who invited you to this discussion today, and they will help you with that. So Jeff and Bernard, do we have any other questions that were lingering out there that we did not get a chance to directly get Dr. Prasad to respond to? Let's see if we can't make sure we get all of them cleared up.
Also, Jonathan, I always ask when they ask me the question about the high-dose antioxidant, until it gets FDA approval, I always suggest them that before you adopt this suggestion, discuss with your oncologist. And if he or she has any question, they can call me directly, and I will be glad to explain it.
That's good. That's perfect. That's perfect. So, and then keep that in mind, folks, that this discussion is not intended to be a substitute for a visit to your primary healthcare physician. So this is just for information, education, and entertainment purposes only. So, and remember, the FDA has not evaluated any of these comments. So Dr. Prasad is a scientist. He's not a medical doctor, and this does not supersede any of the comments that your doctor has told you. If you folks are listening on YouTube and you're hearing this on YouTube, feel free to share this discussion, the edited version of it, once it's released, with anyone that you care about, because the science is solid and sound. Alfreda, you have a question. Oh, next week, by the way, next week we're going to be talking with Dr. Prasad about love your pets. So he's got this thing about food that animals need, and it'll blow your mind. It will blow your mind what Dr. Prasad's formulas will do for your little Fido and your little felines. So make sure that you're there for that. So go ahead, Alfreda. Oh, wait a minute. But you're how is it that you can't comment? You're a co-host. You're supposed to be able to comment.
Hey, Jonathan, she could put it in the question. Another question is CBD good for anti-inflammatory?
Is CBD good as an anti-inflammatory? Does it help with inflammation? CBD, does the CBD help with
indirectly? It does help some inflammation because it is present in the immune system, and so it does. But I mean, as far as the cancer is concerned, it improves your sight. It doesn't have any direct effect on cancer cells, but it helps you reduce your anxiety, depression.
So no direct effect on inflammation. But it does.
It will reduce because we have micro daily is sufficient.
Okay. Micro daily will take care of the inflammation.
Reduce inflammation and oxidative stress. You don't need it just for that purpose. You don't need a micro daily. And the CBD is very important to maintain to reduce your depression and anxieties. And
gotcha.
Very important. Then you can sleep better.
Okay.
Okay, I'm here.
Yeah, you may have a second device open. Go ahead. We can hear you okay.
I just wanted him to comment on prostate cancer.
Any cancer, for high-dose antioxidant, it makes no difference what kind of cancer it is. They also will get inhibited, killed by high-dose antioxidant by blocking glucose uptake and glutamine metabolism. And so this is for every cancer, no matter what kind of cancer. It doesn't, whether it's sensitive to chemotherapy or radiation or resistance, makes no difference.
Right.
Because mechanism death that this produce high-dose antioxidant is totally different. It doesn't distinguish what kind of cancer you have.
That's excellent. That's beautiful to hear. Okay, any other questions that are lingering out there, Bernard or Jeff?
Once again, they're asking him to clarify what exactly is a high dose and taking how many capsules per day. So some
3
new people
times.
on
I
here.
think if you come
Three
into at
times.
least 9 to 12 capsule per day.
Yeah, so that's at least 3
Not
times
per
the
day,
normal dose.
per dose, twice a
Per
day.
dose.
Yeah,
Per dose twice a day.
morning.
So 9 to 12 capsules twice a day.
right.
Mhm. And
And-
of the
and-
powder, it will be 3 or 4 packages
3 or 4
twice a day.
packets twice a day. Yes.
And another person is asking how many CBD should they give their 17-year-old that's on depression?
I think CBD, if you are if you are a cancer patient or any patient, I think you can take up to 100 milligram of the CBD whenever you want before going to bed or anytime. Really, it makes no difference.
Excellent.
And for epilepsy, Dr. Prasad, I think you told us that half
Yeah,
that
epilepsy
is
is-
750 milligrams.
Yeah,
Is-
epilepsy, if you have an epilepsy type of disease, but I'm saying that if cancer patient
Right.
is just have a temporary disorder, the anxiety and depression, not permanently, but temporarily, then it is
Right.
sufficient to have 100 milligram. You can go, if it doesn't work, then go 200 milligram. It is non-toxic, non-addictive, and so no problem.
That's it. I wanted you to just kind of bring that point out also, that up to
Sure.
half the bottle is safe. So you
Yeah.
can go up if needed. So it's okay.
Yeah.
So start
Yeah.
with 100 milligrams, which would be maybe 2 capsules.
2 capsule, yeah.
And then you can go to 4 capsules if necessary. And I have heard individuals taking as much as 6 and 7 capsules at once.
Yeah, again, I said it is a negative,
Depression.
depending
Yeah.
upon what kind of you have a chronic, but just like anything else, if you have chronic, if you're taking very high dose, and now you say, oh, I'm feeling great, then maybe you want to see gradually decrease to lower level.
Right. That's it. That's
Because
it.
one of the problem with toxicity of high dose antioxidant for a long time, it inhibits the enzyme called P5450 in the liver, and that enzyme is responsible to degrading all your medication that you are taking. So if you're taking very high dose of CBD for a long period of time, that enzyme inhibited, and then the level of medication in your blood will increase, and that can cause toxicity.
So we're talking long time, like 6 months to a year or more.
Yeah.
If
So,
they're taking high doses.
for short term, it is okay. But
Mhm.
long-term consumption, that's one of the problem with high doses of, and high dose, I would define anywhere, anything over 500 will be high dose. But see, in children, 750 cases, that extreme case.
And
there is
that
no
would be extreme.
alternative.
Nobody
And
would be
children
taking that
at-
much.
And children at that stage don't take too many medication.
That's right.
But suppose many people, if older people taking 3, 4 different medication,
Right.
that's a problem.
That's right. That's right. Okay. And someone else asked a question about Parkinson's disease. I know that glutathione, which microdaily causes an increase in elevation in glutathione levels, has been very beneficial when it comes to Parkinson's disease.
Yeah, by overall, because again, free radicals are very important oxidative stress and inflammation. And if it's not the familial, then Parkinson's disease can be, first, prevention is one. And if you are getting any kind of treatment, and one of the treatment is dopa therapy. And dopa is very essential to form dopamine. And that's what's happened in Parkinson's disease. Dopamine is reduced. So you're providing it. But what happens sometimes, that excessive amount of dopamine is formed, then they get oxidized and generate free radical. So after 5 years, average 5 years, patient becomes worst. So how do you improve that? If you take say, microdaily in our, say, for example, core 4,
Yeah.
this will not interfere. This will not only improve the efficacy of dopa, but prevent the potential toxicity of dopa therapy, so that beneficial will last longer time than it is today.
That's beautiful. That is just beautiful. Well, Dr. Prasad, I don't know. All we can say is thank you, because you shared with us some gems of wisdom and insight that we would not have access to otherwise. We appreciate your bringing as much as you brought to us today. We've got a greater understanding of how the body and high levels of antioxidant therapy, like the kinds of antioxidants in Micro Daily, why it is that people are getting the kinds of results that they're getting as they're battling with things as deadly as cancer, even while they're taking their conventional medication, just taking it as a supplement. We understand it so much better now, Dr. Prasad. So thank you very much for sharing that with us. So, and I hope everybody on the call today, we have 250 lines.
Yeah, that's the most we ever had.
Oh, it's huge because people need to know. They want to know about cancer. They want to know about the impact of these formulas on their body. So we owe a debt of gratitude to you, Dr. Prasad, for what you have produced and what you share with us on a regular basis. So remember, folks, next week, we're talking about pets. So if you know anybody that has an animal that they like, you want to have them here next week. And keep your eye on the calendars, and that information will be shared as to what and where Dr. Prasad will be discussing things in the future. Stephanie Roberts has one more question before we wrap up.
I got a quick one. I understood that one potential customer said her doctor said she couldn't take the EMF because of vitamin B in it, and that would affect her cancer. Is that correct?
No, first the just taking a preventive dose of Micro Daily, doctor is correct. Don't take a preventive dose the way it is, like a 3 capsule in the morning and 3 in the evening, because that will compromise the effectiveness of chemotherapy and radiation. But doctor is correct. But if you are taking high doses of antioxidant, which we are suggesting 3 to 4 times of the preventive dose, then that concern should not be there. And if doctor doesn't know about it, he can call me to discuss it if you want to.
Sure.
There we go.
Thank you so much.
Sure.
And Dr. CJ.
Thank you so much. This has been so magnificent. I'm so grateful that you all, Dr. Prasad and Jonathan and Bruce and everyone else who put this together, gave us the shortcut to how this is working in blocking cancer cells so it suffocates. One quick question. I have patients that I want to put on the new omegas because I know it helps so much with the neurological damage and the neuropathies, but I've got vegetarians. So what can we do? Do we have something coming that will not have a bovine capsule?
No, I think, you're talking about the omega-3, right?
Yes, sir. Yes, sir.
Yeah, omega. I think for vegan people, omega-3, I think I'm not sure, but I think it is available in the marketplace. You can check it in Amazon. If it has been isolated from algae, because algae is the one, seaweeds, they are the one who makes omega-3 fatty acid, and the fish just eats them. So the capsule has been formulated, obtained from the seaweeds. So if you can find that kind of omega-3, it will be good for people who are vegan.
Thank you so much, sir.
Sure.
Thank you very much, Dr. CJ. We appreciate again your comments. Okay, so there we have it, folks. We look forward to having you all back with us again in the future. And we look forward to having Dr. Prasad back with us again next week. We're talking about pets. So no opportunity meeting today, but my group, see you guys at 6:30. Have a good night, everybody. Thank you again, Dr. Prasad.
Thank you.
Let's go.
Hi, Dr. Prasad. Hey, and nothing
Cancer
on
part 2.